Once again, hospital. His previous position at the hospital was CTO. And in his career at the hospital, he has been very instrumental in helping the hospital with its strategic technology direction, as well as managing some patient care services and bringing the excellence that he has done over the years to this field. As well as being his most notable accomplishment was the opening of the Anderson Pavilion. Marty has done all of this with the excellence that he has done throughout his years of his previous experiences that he was able to get through the care payer market, where he was responsible for five mergers and an acquisition of a hospital. He was also part of the executive team that led that company to its initial public offering. Marty has further held executive positions and has on his career. What I tried to do today, instead of just repeating his bio, was really bring something different and try and tell you something about Marty that none of you do know. Marty's most probably the only CIO I know that actually monitors his sleeping patterns. So Marty does this with great intention. His intention is to obviously get more energy and maximize his ability to perform his duties, which he has done very excellently, and it's very evident that he has been able to do this. So Marty is what I know of only one weakness, and that's unfortunately his support of the Dallas Cowboys. Now, I do believe if Marty attempted to teach the Dallas Cowboys how to sleep better, he might be able to finish his career in the most beneficial way possible. I'd like to introduce Marty Miller to all of you, and it's my honor.
Well, I don't know who that guy was. My wife, last night when we were preparing to go to bed, she said, "What's your day look like tomorrow?" And I told her that I was going to be speaking here today, the Southern California CIO Forum. She laughed. She said, "That's cute in healthcare by 2020. This is an opinion, and if you have a different opinion, let's talk after." I do enjoy that kind of debate. Now, possibly you had a little bit of anxiety when you read the word transformation in any slide deck. The model is shifting. Thinking about reviews, which is a very social aspect to what our life is today. Thinking about reviews, if you looked at this list, and you notice the one at the bottom has 14 reviews, but the one at the top has 384. Does that weigh in your decision making? Absolutely. Why do you not have this in healthcare? I say that. Why do you not have it? Why do we not have it in healthcare? But we do. Boy, this slide, is it showing correctly? Yeah. California Office of the Patient Advocate. By means of HEDIS and CAP scores, they began to put together ratings of health plans. They also have them by medical groups, and they rate them kind of on two major categories. One, what's the quality of the care that they're delivering? And two, how satisfied are individuals with the care that they're receiving? When I saw this site the first time, I thought, oh, this is great. Look at that. The first one, sorry, it's cut off on my screen. Aetna, HMO provides recommended care, 3 stars. I wonder why that's not 4 stars or 5 stars. It's a 5-star system. So I clicked on that right there. Anyone know what it did? Nothing. Absolutely nothing. It doesn't go anywhere. There's no data behind it. And then patients rate their experience about the HMO. Here's really the two dynamics. I can get care easily, and the HMO helps me get answers. That seems very limited information when we think about the world that we live in and how rich of information we typically get in every other decision in life. And if the model is changing where the costs are shifting to me as a member Well, I want better information to make decisions. If I have a problem with asthma, and there are 20 doctors in my network that all handle asthma, what things do you think I want to know? How good's the quality of the outcome? And how do others feel about the service they provide? So, here's a question for you. Thinking about this kind of website, you can get out your phones again. I'm sure they're not far away. Question here. How many people who do not work in healthcare, think about your neighbors, friends, how many of those people do you think know about resources like this? I didn't ask that question right because yes, no. Let me try again. Do you think most people know about this kind of website? Yes or no? You think most people who do not work in healthcare know about this kind of information? Sorry, I'll quit clicking back and forth. I'm rooting for yes. I can't tell how many votes. I forgot to turn that on in this poll. Did we only have one vote? No, there we go. It does work. Thank you for whoever put that in there. I decided not to ask the question, how many of you know about these kind of resources, because that's probably not fair. One, we would never admit that we don't. Two, of course we do. But do we really think most people who don't work in healthcare know that this data exists? The answer is loud and clear. Most, we feel, don't. They're so desperate. People are so desperate for information when thinking about their own health care. Go to Yelp and type in doctor, and up pops this little box. More categories. Here, I'll do it on both sides. More categories. You can find a doctor who is a dermatologist. You can find various subspecialties. You're probably going to say, boy, they don't have all the subspecialties there. You're right. Because people are so desperate for good information that they have begun to... This particular doctor, you'll notice the one at the top, they gave him 4.5 stars. But if you look closely, I don't know how well that image shows, maybe not very well at all, but if you look between all 4 of those up there, there's approximately 8 reviews. People are desperate to know. If you were diagnosed tomorrow, unfortunately, with some sort of chronic condition, and your doctor said, well, there's, check out one of the specialists in our network, and you looked and there were 5, what's your first question? Who's good? And how do you normally get that answer? You ask your doctor, who do you like? Well, I play golf with Jim. Jim's good. We are so information deprived when it comes to being a member in a healthcare system. Think about this. So here is a scenario. Imagine you needed to get an MRI. And imagine if you could get this information from your medical group, their website, or your healthcare delivery network. Imagine if you can get this. I need an MRI, so I can go to 4 places. Northside, Speedy, Fancy, 5-star. What do you know from this slide? This is not off a real website. This is just, because I wish it were, this is just created to be provocative. I think that was the charge Scott Zabula gave to me. Be provocative. What do I know here that I normally don't know? Well, I know how far it is. I know what other people potentially think. And it only works, of course, if you can click on the rating and read other reviews. Boy, if I knew how long it would take me to get there, and then do I have some sort of out-of-pocket cost? This would work for something outside a network. You see a variation of cost. So if you look at this, you might be inclined to say, well, although Northside Imaging is only 1/2 mile from me, and $110, which is kind of the second to least expensive, the wait time is over an hour. I just don't have that kind of time. I really only have 18 minutes, but I don't know that I want to spend $240 either. Do you find yourself going through the thought process right now of saying, which one would I choose? This is the kind of information that would change healthcare. I'm going to one-up it. What if it said this? They're all the same. They're all exactly the same. Would your decisions be different now than they were on the last slide? Absolutely. This is the kind of information we see in every other endeavor and industry that we tend to interact with, but we don't have it pulled into a single place that is convenient for us as members. Here is one that I had to pull out because you are a technology audience. I imagined to myself, what did Best Buy go through when they decided we're going to start putting ratings up about what people think of the products they buy from us? So I'm going to buy a TV. What are the dynamics or the key metrics they should rate on? Well, you could imagine that the folks from the manufacturer, Samsung, Sony, Sharp, all said, well, we want them to rate the packaging. And we want them to rate, whether or not they got all 90,000 pixels on the 70-inch display. In IT, we tend to be very technical about things. But ultimately, notice what Best Buy did in this particular rating for buying a TV. What's the picture quality? What's the sound quality? How do you like the features? Those are the things that speak to people very easily. Medicine is far more complicated. When you think about HEDIS scores and what goes into the quality of treating certain diseases, those are very complicated and should not be touched. Well, I shouldn't say shouldn't be touched. They're very complicated and deserve to be very complicated. But when it comes to how you interact with your physician, did you notice back on the Office of the Patient Advocate site, there were only two things. Did they give me information? And I forget what the second one was. It meant nothing to me. Probably didn't mean a lot to you either. What if instead, after you went and visited a doctor, any doctor, your primary care or specialist, you had... Have I lost it? Okay. You had a survey to fill out, and it did very common sense things like this. The office was clean and welcoming. Office staff was friendly and helpful. The wait to see the doctor wasn't too long. My doctor spent time listening to me. That is my wife's number one issue. Did they seem like they rushed through the 3-minute appointment, or did they spend time listening to me? Here's her second favorite. Nope, not yet. My doctor seemed knowledgeable about my illness. The second favorite, my doctor offered options for treatment. Any of you ever go to a doctor and you had a choice of one option? It's only my wife then, and you. I have. Office staff helped set up follow-up or referring appointments. I cannot tell you the horror stories I know of friends who chase referrals for months. But if before you left they said, here, let me set that up for you, and they did it. Wow. What a concept, right? What if you had a survey like that? And that's what kind of went into the ratings score that we showed a little bit earlier. Wouldn't you have much better information for making decisions? Now, thinking about some of the wellness applications. Again, as you're trying to attract members to your health system, to your integrated delivery network, how will you use things that clearly people are starting to use, Fitbit, MyFitnessPal, things like that, to engage them? What role will communities play? There's an interesting article on Forbes about patients like me. They said that they are quickly becoming a platform for clinical research, which was an unintended venture. But they're finding that they're having some success. And it doesn't have the same rigor around it that standard research does, but it will be interesting to see what happens. So what role will communities play in your strategy to deliver health to your members? Let's not forget email. This was a study that was published and sent around this week at our hospital because it's a children's hospital, much like CHOC. 77% of parents would use email for minor illness as opposed to going into the office. Again, a technology we normally use to communicate with nearly everything else, And we're still kind of at the beginning stages in healthcare of trying to have these kind of communications. Can't be ignored. You'll see this later, but if you're taking notes, you might want to read this. This is a blog. This is not intended to be scientific in any way, shape, or form. It's a blog by Richard Krasner. 5 reasons why virtual doctor visits might be better than in-person ones is what it's called. I cannot remember all 5 because I don't have the speaker notes up here, but I'll tell you about 2 of them that resonated with me. Number 1, patients prefer virtual waiting rooms over real ones. How many of you have kids? Ever take them to the doctor when they're sick? What happens? There's the 2 waiting rooms, right? There's the well waiting room and the sick waiting room. And so there you go to the sick waiting room and you sit in a very tiny little chair next to your kid. And the person's kid to the next of you is coughing all over you. And of course, my son got whatever he needed. And 2 days later, I got whatever he had. Patients prefer virtual waiting rooms over physical ones. That was 1. Number 2, patients feel like the doctor pays better attention to them in a virtual visit. That was interesting. There's no other distraction. It's me and you. It's a very interesting article. I think you will find that as you read it, the 5 reasons just innately appeal to you as a person who's just interested in getting good health care for yourself and for your family. So those are things, video and Skype and all these kind of FaceTime sort of applications we use all the time can be incorporated into what we do in healthcare. And many institutions are making remarkable progress around it. But these things, the application of these very social applications and technology will transform healthcare. So here's the question. Who's going to lead the way? Anyone know who the guy on the left is? Any takers? No. Okay. Yes, it is. Yeah, it's me. Try harder. Man, the bigger that gets, the worse it gets. Anyone? Who do we think he is? He's the typical healthcare CIO. The signs are all there. And if you're saying to yourself, gals, why did he show a man and not a woman? You'll quickly understand why. He has all the signs of the typical healthcare CIO. He's lost his hair. He's graying. He hasn't slept. Thank you, Kevin Torf. Hasn't been in the sun for a while. There's a whole lot of comfort eating going on. Typical healthcare CIO. Who's the guy on the right? He's likely to be the person, and it could be a guy or a gal, who gets tapped on the shoulder to lead the kind of initiative we've just been talking about. Now, why? If you're asking yourself, is that a subtle reference to age? No. It's an overt reference to age. Why? Two key reasons. 1, thinking. I have a daughter who's 16, and I can tell you her thinking is remarkably different from mine or her mom's. Youngsters today do so many things out of social responsibility. They have grown up in a world where Google provided all their applications for free, and they feel like everything should be very transparent. And if you found yourself, as I did when I was writing the presentation, if you found yourself listening to some of these things and saying, now I wonder if we could build an app and sell it for $4.99 and maybe we can get like a $10 a month kind of subscription thing, that's a hindrance. People of this young, healthy generation who you want to engage and attract do not think like that. So number 1, there's definitely a difference in thinking. Number 2, here's our CIO again. Responsibilities. Think about the responsibilities of a CIO. Containing costs and uptime, a responding culture, regulatory compliance. While you all ate your sandwiches at lunch, I got to update our audit committee for an hour. These responsibilities, if not carefully managed, could actually get in the way of you being able to forge forward with a very strategic project. Now, all that being said, who really is the right person to lead it? The CIO. He is, or she is. Why are they the right person to lead it? Two reasons. One, they know about the gaps in thinking. Other executives may not. They may not understand them as well. Number two, CIO has a track record of delivering strategic technology projects. And as you have likely noticed through this presentation, we're not talking about having a presence on Facebook. Or can we somehow use YouTube and put up neat little videos? We're not talking about that. We're talking about how to take principles behind this technology and make it into something that members, consumers really want. How do you do that? How do you supply the right information elements? Well, no one knows that better than the CIO. We've had a conversation already earlier about that very thing. So the CIO is the right person to lead the way. Thinking now about the last few minutes of this, here was our original slide where you got to vote. Which technology do you think will create the greatest transformation in healthcare by 2020? The punchline is everything we've talked about cannot be done in a silo. All of these are absolutely critical if you're going to create the kind of tools, information-rich tools, that members in your health system really want. They're all vitally important. But I'm still sticking with this one. This is the one that I think is going to make the biggest change. Thank you. Are there any questions that I can answer? I don't think I have another slide. That's the end. Yes, right here, please. Specifically around ophthalmology, which is our pilot project with it. But it's difficult. Good.
I have a second question.
Yes.
You talked about community, you talked about members, you talked about apps, you talked about customer service, and you talked about internet-rich tools. There's a lot of us out there that are using Fitbit, Body Media, Garmin. We're capturing that data. Why don't you just charge me $100 a month? I never go to the doctor anyways. It's a free $1,200 a month, or $1,200 a year for you. And why are we not utilizing all of those things as hospitals for the community and the technology to do redundant tests, to take that and move it out of the hospital, but make the hospital part of it?
I think that's an excellent question. In fact, you mentioned several things, and I'm probably going to forget some of them, but I'm just going to say a few things and comment to that. Number one, if you're getting capitation, and so it's fixed, you're going to throw whatever tool you can at them. Number two, thinking like I'm just going to charge you $100 to give you something, I wouldn't do it. If you joined my health plan, I would say we want to keep you well. Here's a Fitbit. Or a very, very nominal cost. You know, when we do that in a workplace, we generally will say, normally it's $100, but we're going to subsidize 75. So if you're interested and you're willing to spend 25, we're willing to do it. So there has to be some way of not just giving out Fitbits, obviously, but getting them to engage. My opinion is it should be heavily subsidized. And again, in the world of capitation where you're already getting your money, throw everything at them that you can to keep them well. I know my personal cost to the insurance in a year. And so, yes, I track my sleep. I track what I eat. I have a little bit of OCD about all of it. But yeah, definitely. But I also know that I cost them very little as a result. So the longer we keep them healthy and well, the better off I think everyone is in that continuum. Thank you. Yes, please.
I got it.
Where would you rate genomics in your list of technologies?
Well, I purposely didn't put it in there. Healthcare institutions, specifically medical the medical field must continue to make advances. And we have a little part of our institution that's beginning to consider personalized medicine, and those advances are very important. But how will I know that you really do a good job of providing that, better than what he does, if I don't put it out somewhere and let other people speak about it? We really like the genomics work, the personalized medicine your institution does, and we find we get fantastic treatment as we go there. But if we go over here, then maybe it's just ho-hum. So that medical technology, that research has to continue. And again, back to that slide of, what are all the technologies? That has to continue. But the one that I think is going to make the biggest mark as costs are shifted to you will be the information you get using social technologies.
I don't disagree. Just why was it not on the list?
Oversight.
So I did vote for social technology, so I think that was a good choice. My question, actually it's more of a comment. I think it really gets into social media responsibility. And since you referenced Yelp in particular, I just wanted to call it out that this past week is probably the third time I've heard this, that providers often get a bad rap from consumers, and yet they don't have a chance to rebut what's placed on them. If they do, in fact, if they don't pay extra money to Yelp, they get dinged. So it's just a comment that, I think as we look at going to this new social age and we have to start bringing it in together with medicine, we got to take certain things with a grain of salt, or maybe they should be measured themselves. So
Yeah.
Just a comment.
Yeah, and I would have to say that I agree. And I think the first time hotels started getting rated, they went through the exact same thing. How do I have an opportunity to correct this? And we also know who responds to surveys. Either I'm really upset about something that happened, or you just absolutely wowed me. And all that middle seems to get lost. Over time, it does balance out. But yes, that is a hurdle that we have to get over. But it does send a very important message, especially to this generation of young, healthy adults, and that is, I'm willing to be transparent, and because I'm willing to be transparent, I want you to trust me. And they connect with that message. I will say, we were having a meeting just 2 weeks ago, and the meeting was about how HEDIS scores are going to be published about hospitals, and someone who assists our executive management, let's say, part of our board, asked the question, what if the HEDIS measure that you send off isn't very flattering? How do you control that message? And the answer back was, you don't. There's nothing you can do. But we think like that. How do we control and do that? This younger generation, that's part of the risk. I want to be transparent, but as a result, I'm asking you to trust me because I'm being transparent. And there are certain things that you can be very open about. Just your rating of the visit. HEDIS scores, again, complex, for a reason. Quality measures should be measured scientifically. But, how I like the visit, different thing. But we do need to trust that over time it averages out.
And over here.
So, we're looking at some of the same pieces of information we want to give consumers and patients, and we're trying to decide in IT how much we should do and how much we want marketing to do. As a CIO, where do you see that split? Where do you end as IT and marketing begin?
Marketing should own a large piece of the strategy around the messaging of how to engage members. But IT knows where all those information elements are and how to build those systems. There was also a data point, if any of you went to the Gartner conference in Orlando in October, there was a data point there about the average tenure of a chief marketing officer is between 2 and 3 years. And so in many cases with that kind of, high turnover, they're going to have a hard time seeing something like this through. This will be a very iterative process. There will be certain pieces of technology you put out first, and then you kind of build to your market. it'd be great to have something out within the next 18 to 24 months. But realistically, we're not going to have all of this together because, as you know, the healthcare environment is very complex, and so you may be relying on data elements from various sources where you simply can't get it yet, or we're not completely there. So for that reason, the messaging, definitely marketing. The execution, definitely IT. You pick, number 2.
You can only see one. Thank you. In your presentation, you made 2 comparisons, which I would like to maybe elaborate on. You implied that healthcare is like any other industry, an open market. Well, I go and research the physician that I want to go to, but I don't do it like on regular websites. I just go to my payer's website because the PPOs have a fixed segment. The second one is the providers don't publish the cost. So if I want to look for a physician or a cost of some kind of a procedure, a medical procedure is not the same way I will shop for an oil change. So those prices are never published. So that's really the issue we need to overcome. And when I get a discounted price, is discounted price of what? So maybe we can address those points.
I would say on the second one, for 4 years, I worked for a company that managed medical groups. And if you walked into my office any day of those 4 years and said, I belong to this plan and I want this done, I could tell you that cost. And that was 7 years ago. It is contained electronically somewhere. We don't do a good job of bringing that forward to communicate up front. And that really was my point about that slide. Exactly. So that really, we have the information because we can pay claims and we can send you a bill for the remainder, so we have it. It's about how do we put it up there up front so that people.
How often does your IT department publish user statistics out to the user community about your performance?
We have a dashboard. It runs 365 days a year. So if you want to know the average SLA for how quickly tickets get resolved, if you want to know the number of, the severity level tickets, number of changes per month, how many outages, you can do a custom search, whether it's yesterday or over, 9.5 months or whatever. It's a dashboard that's open to the entire institution any given day of the year.
I have a question. I'm John Risk.
Hey, John.
I have a real passion for the video and the kind of things that you were describing between the patient and the clinician. And I'm not clear yet on how all that gets monetized and how it's paid for and whether it's going to be a contribution on the part of the healthcare provider, kind of in a community ed thing. Kind of as you compete with places like CVS or Walmart or Rite Aid or whoever is going to be getting into healthcare services and accountable care organizations. Are you embracing, I guess there's 2 questions. The first is, are you embracing the role of accountable care and urgent cares in these pharmacy-based services as an augment to the services you provide your patients so that when you discharge them and they go out, you've already kind of teamed them up with someone who might help them outside of your hospital in that level of care? That's the first question. And maybe I'll just pause at that, just ask that question first.
I believe the healthcare model of the future most likely to succeed will look like an integrated delivery network. And so today I work at a standalone hospital. And it's a very difficult economic proposition for standalone institutions. And I think outside of California, you've probably seen a little more merger and acquisition, but it's starting to happen here. In the LA Basin, there have been several partnerships announced recently, and whether those all become part of a larger delivery network or how that all shakes out, I do think we will see some consolidation. We do have folks here who do run these large delivery networks. Bill is one. I don't know if we have anyone here from Kaiser or Scripps today, but we clearly have those here in the LA area. And I do think that kind of the economics behind it, that's eventually how this beast has to move.
Okay, thank you. And then going on to the second question, to move toward this future of people on their iPads talking to their doctors or at home using their television to communicate with a healthcare provider. What is your job in the IT side to make that happen? How forward are you looking at implementing something like that? And what are the nuts and bolts that you're having to turn to even test it, to see if it can work? And what are the complications that you're facing doing that?
So I'll tell you about what we're doing. There's an interesting little fact about being reimbursed for any sort of virtual visit. As it stands in the state of California, you cannot be reimbursed for a virtual visit that happens where the patient is located in their living room. So they have to come to a facility, at least for us. Maybe, do you have something different, Tim? Same? So that's, at least for us, and perhaps others have something different, they have to come to a facility for that visit. So until things, and I'm not familiar enough to know whether or not global capitation would allow that sort of visit as being an allowable expense, but I would tell you as it exists today, they have to come to a facility. In our particular case, all of our satellite clinics that we have in the LA County area, they're all being outfitted with telemedicine, telehealth equipment. We piloted it in our South Bay facility. We have done telemedicine sort of applications for several years now with both Puerto Rico and Panama, and those have been very successful as well. But it's a different model altogether, and probably not as relevant to the question you were asking.
Good afternoon, Clark Kegley, Scripps Health. Great presentation. One of the things we've struggled with so much is, as you think about access to clinical information, working with patients either through home health or really any kind of remote engagement, our legal and our health information folks struggle all the time with what is truly part of the legal medical record. Can you talk a little bit about what you run into and whether you've got any pearls of wisdom on that topic?
I have no pearls of wisdom, and my lawyer will not let me talk about it. I will say simply that is a challenge that you have to work through in the last 30 days. That's why I smiled at the question. We've had the conversation internally at least 3 times. But I think it's part of the road ahead. Like Mr. Murphy's quote, I forget who the gentleman was he quoted, he said, "We can't predict it. Our job's to navigate it." So, no pearls of wisdom. Sorry, Clark. Yeah.
We have time for a few more. There's one over there, Steve.
Thank you. You know, those of us in healthcare and healthcare analytics, we tend to have a very analytic approach to stuff. We moved to a new community, and before I knew it, I had a new doctor, a new dentist, a new chiropractor, all of whom my wife had selected based on referrals from the hair salon.
It's normally where you get your best referrals.
So I went to the first...
or the nail salon.
And it gets worse. I went to the first one, he was a hunk. Went to the second one, he was a hunk, and so on. Fortunately, the first 2 seemed relatively competent. So my question is, the patient experience is obviously really important. And when we think about, I work in surgical informatics, so when I think about what would I want the surgical experience of tomorrow to feel like if I was going to experience that. We used to brag about our physician. Hey, I've got the same doc that did the Lakers. Now we really start to think about, we realize the anesthesiologist and the nurse probably has more influence over my safety than the craftsman that's going to perform the surgery. So as we think about all that stuff, the collision between relying on a Yelp-like reference and the emphasis on analytics to help improve the performance of healthcare professionals, but obviously, hopefully, give other people outside this room a more informed approach than they're going to get from a Facebook buddy saying, "This is where my sister went to have a procedure done." How do we begin to converge the benefit of both of those? Because when I look at the rating scales, you know, I see deficiencies there.
Mm-hmm. Yeah, I think that's a really good question, and I think everyone in this room, I'm going to just lump you all into this. Everyone in this room, I believe, tends to be more analytical in nature anyway. We all want really good information. Part of it is what we do for work, and so we've kind of been molded that way. My reference to a more simplistic rating is about most folks who aren't in the same job, kind of innately certain things resonate. Did my doctor listen to me? It should not be the entire scale, but it shouldn't be excluded from the scale either. And so that's why I think, what the state has done with the Office of the Patient Advocate to show quality outcomes, which are based on very scientific, analytical metrics versus how other patients or members rate their experience. They're trying to combine both of those. And that's where I think the play is for everyone in this room. You don't want it to end up like Yelp, but that's all people have. They're so desperate. Control that destiny, which is the other thing we do really well in IT. We control plenty of things. Control that destiny. Shape what it should look like. I guarantee you, if you're the first to market, everyone will flatter you by imitating you. Any others? Well, thank you very much.